Hi everyone, it's James Braithwaite here again at Yorkville Physiotherapy in downtown Toronto, and I'm going to talk a little bit about sleeping position today. Now I know that we already did a sleeping position video a couple of videos ago, and I promise it'll be different today. The last one we talked about neck position, right? When you're sleeping and how we want to try and avoid sleeping on your stomach to keep your neck out of this sort of side bent, rotated position and in a neutral position. All that stuff still counts. We love that. But today we're going to talk about knee positioning when you're sleeping. And we're going to talk about this because I had a patient earlier today ask me this exact question. Should I or shouldn't I be placing a pillow underneath my knees? Because there are sort of two different groups of conditions for which a yes or a no to that question is appropriate. The first is folks who are coming out of a surgery or long-term illness, and for those folks it's often recommended that you don't place a pillow underneath their knees while they're sort of in this laid up position for a period of, say, a week, a couple of weeks, that type of thing. And there's a very good reason for that. The reason is that if you place the knee into a chronically shortened position, so a bend in the knee, so the soft tissues crossing the knee are short, long, short, right? If you place them in that chronically shortened position, they can adapt to that shortened position and shorten up themselves so that you're unable to extend and lengthen the knee again. It's called a flexion contracture when that happens. And again, if you're in that sort of bent position for a period of days or a couple of weeks, you can develop that type of set of circumstances, which is a real hassle to correct after its onset. So there's a case where you want to avoid having the pillow underneath your knees. The other sort of side of that coin, though, is for people who have acute low back problems that require a relieving position, a comfortable position to get them through the night. And for some people that involves getting into a sort of semi-Fowler position, so something maybe more like this, right? Like that sort of reclining type position. Without which they can't get to sleep because of acute low back pain. And if you're that type of person, then yeah, you got to get sleep. And over a short period of time, a few days, and just being in this position at night, and not through the day as well, as might be the case in an infirm or illness or injury type situation, or surgery type situation, excuse me. In the absence of that, this can be absolutely legit and an okay thing to do to get you a decent sleep at night. So, different situations, different circumstances, different answers to the question, should I put a pillow underneath my knees at night? So hopefully that sheds some light on that issue, because if one person's asking me, I'm sure that there's other people who have the same question as well. So if you have any questions on either this or any other topic, be sure to let me know. I'm happy to do a video to talk about them, so I'd be pleased to hear from you. Drop me a line. James Braithwaite at Yorkville Physiotherapy.